Hey everyone, thanks so much for joining us for another episode. I'm super excited today to have on Liz Burstein, the co-founder and CEO at Neura Health. Liz, how are you today?
I'm doing great. Thanks for having me.
Yeah, I'm excited to have you on. This is a pretty long name, so when I say thanks for coming on the podcast, well, people will know which podcast I'm referring to, but it's definitely a mouthful to say. So I'm excited to have you on to talk about your company and your 2.2 million seed raise that recently was announced. Congratulations! I'm sure you and the team are fired up.
Thank you. Yeah, it's just, small beginning towards a very mighty vision, and we're thrilled to get started and have support from wonderful backers behind us.
So I think it would make a lot of sense, Liz, if you give the audience a quick little bit about your background, and then we can give us kind of a snapshot of Neura Health, and maybe talk a little bit about that long term vision, what you're able to share, and then we'll talk about a couple topics, but short and sweet.
Yeah, sounds good. So my background's in building technology products from the Silicon Valley. Spent over the past decade building tech products that really deliver on missions that are meaningful to me. So I started my career early on at LinkedIn. I was a product manager there. Worked on LinkedIn.com, LinkedIn Recruiter, and throughout my career, I've continued to rise in the product management function. I was a director of product at ZocDoc, and then most recently, before founding Neura, I led product at a company called the Maven Clinic. They're a virtual clinic for maternal health. So the past couple years, I've taken my career more towards focusing on the digital health side. I think there's no shortage of problems to solve in the health domain, and based on my own personal patient experiences and seeing some of the healthcare conditions I've seen family members and close friends go through, I've decided to really focus my career on kind of the marriage of product and technology with healthcare. I'm really fortunate to be building in a time where there's a lot of investment interest in the space, health system interest in the space, interest from doctors to innovate and drive better patient experiences. So, towards the beginning of the pandemic, I unfortunately started to suffer from a chronic nerve entrapment, and that is actually what inspired me to incorporate and build Neura Health. Through that patient journey, I saw over 40 specialists, one of which was a neurologist. But what really shocked me in that patient journey was I ended up having to wait over 6 months to just get a neurologist appointment. And that was in New York City, where we have some of the best supply or density of doctors. So that got me interested in what does this problem look like nationwide? What does it look like in medical deserts and other metropolitan cities, even where there's lower supply of doctors and specialists? So I ended up talking to over 100 neurologists, pain doctors, physical therapists, just really trying to understand the problem. And then I moved over to talking to the patient side, talked to hundreds of patients of chronic pain, multiple sclerosis, Parkinson's, Alzheimer's, epilepsy. Started out with friends and family members that I happened to know, and then ended up just kind of continuing to network through second degree connections. Spent a lot of time in chronic pain support groups online, like Facebook groups. And through all those conversations, I saw a massive opportunity to improve access and quality of care for neurological disease, for focused on chronic migraine at first, because it's really easy and safe to treat on telehealth. And it's also a massive market. It affects 40 million Americans. And overall, neurological conditions affect over hundreds of millions of Americans. So it's a massively underserved market. And I partnered with a friend of mine from Stanford's computer science program as my co-founder. We met back in 2009 in Stanford's computer science program, and we've been building up the product and team to this day.
Well, congratulations on all the success up to this point, and I know you're just getting rolling. This is just the beginning, and that's what's so exciting. This is also the most fun part, right, of putting together the business. continuing to grow out that initial team that's really going to propel the business to those next phases over the next several years. And part of what's going to help with that is this recent raise. So can you give us a quick snapshot of, you raised $2.2 million, was a seed round of funding, who was involved, and then maybe talk a little bit about, obviously the reason for the raise is to grow, but maybe areas that you'll be investing in moving forward?
Yeah. Yeah, so our leads in the seed raise were Pear Venture Capital. They're Palo Alto based early investors in DoorDash and Garden Health, which is a well-known IPO in the health space. Norwest Venture Partners, they previously invested in Calm and Talkspace. So really, inspired by some of their learnings and their network, having built those companies. Global Founders Capital, they're based in Germany. Index Ventures, which is behind Robinhood and Figma and many other success stories, and also have Next Play Ventures, which is the fund of former CEO of LinkedIn, Jeff Weiner, who I worked for early on in my career. So yeah, really humbled and honored to have all these amazing backers. We also have an angel investment from Nikhil Krishnan, who's an awesome health tech blogger. And really, really honored to have all these folks on board. And in terms of our priorities for what we're using the funds towards, there's a couple of dimensions of growth coming up for us in the next couple of years. So the first is, in the condition that we're on right now, which is the product line of chronic headache and migraine, using these funds to scale up the team to really build more operational efficiency and patient delight. Just within, staying focused on chronic headache and migraine. And then likely in the fall and beyond, we're really looking to expand geographically from the couple states that we're in right now to going nationwide. As you probably know, in healthcare, it's very local, very regional. So it requires the clinic to be licensed in state by state, and every doctor has to have a license in each state. So that takes time and effort and funds. So that's a component of what the funds will be used towards. The other dimension of growth is expanding to other conditions. So I mentioned we think of our current build as a product line for chronic headache and migraine, but we want to expand and replicate that playbook for chronic pain, epilepsy, MS, Parkinson's, and each of those conditions requires a tailored effort in terms of the dedicated app, the dedicated tracker, spending time talking to those patients, really understanding their needs with a lot of depth. So that's kind of what the next couple of years look like. And the team will, of course, have to grow to help support all those build efforts.
Well, I'm so excited for you and the team. And this is such big news. So I'm glad we were able to talk with you early on in the process. And hopefully we can continuously have you back at points to kind of give us updates on where you're at and any announcements that come up. If you raise future funding, we'd love to have you come back on again and talk about it. But really appreciate you coming on and talking about Neura Health and kind of what's next for the company and this recent raise. So thank you for your time today.
Awesome. Thanks. Have a good one.